And so talking about over-the-counter medications and medication safety for both kids and adolescents, because there's a big adolescent and teen component to this as well, is one of my favorite things to do. So I was really happy when Fiorella said, would you like to come and talk today? So if you have questions, feel free to unmute and talk to me while I do this. If something comes up while we're on a slide, hit me with the chat. I try to leave plenty of room in these for what is coming up in your areas and what you're seeing as well. So don't be afraid to speak up, but I'll go ahead and bring my PowerPoint up now and show you what I have. Let's get it sharing. All right, can everybody see? It's time to talk over-the-counter medications. All right, come on, make it nice. There we go. All right, so this little picture is classic. Little kids get into everything. They love them. Just a little bit about what our Poison Center does. I think most of you are probably from Virginia, possibly from Virginia. The green area is the part of Virginia that we serve. Virginia has 3 poison centers, evenly distributed in population. So our Poison Center serves 42 counties, 48 hospitals, and freestanding emergency rooms, and a population of about 3.2 million people. We do this 24 hours a day, 7 days a week, with currently 13 nurses. So it can get a little busy, and there are times when there's only one of us on the phone. So if you get that hold message, please hang on. We're coming as fast as we can. Sometimes it does feel like all 3.2 million are trying to call me at once. So people ask, are over-the-counter medications really such a big deal? And I love this graphic from the Safe Kids campaign that Fiorella, I think, shared on our Twitter account and our Facebook page. Yes, the bottom line is yes. What parents tell me, I hear this all the time, is I just turn my back for 1 minute. And it's true. No human being can watch a child every second of every minute of every day, because we're not robots. We have to go to the bathroom, we turn around. In ER visits for medicine poisonings, for medication poisonings, parents often say, I just looked away for a minute. Every 9 minutes, a child under the age of 6 shows up in an emergency room because they got into medicine. Research shows that in about half of these over-the-counter poisoning cases, the child climbed something to get to it. Every hour, a young child is hospitalized in the United States, and it's related to medication poisoning. Every 12 days, a child dies, and it's poisoning related. Another thing that we really want you to know is that child resistant is what those medication caps are. They are not childproof. There is no such thing in this world as childproof. And I'm going to talk about that more as we go along too. So I won't sit on this slide for too long. I've got more stuff there later, but it's in the PowerPoint, and this webinar, I think Fiorella's recording, so it will be available for later. So I wanted to just show you, this is kind of some of the main types of things, but the thing I really want you to remember from this slide is a favorite tip from a Poison Center nurse. If it is chewable, if it comes in a gummy form, that kid will eat it until you catch them. They will hide in a closet. They will hide under a table, behind a chair. They love them. They will, the truism that we parents have remembered, I have grandbabies now, is a quiet toddler is the scariest sound in the universe. That is really true. And you really almost have to watch out for your chewable medications more than anything else in the house. Those are probably our highest number of calls. So what are the #1 things that we see? So believe it or not, here's Tylenol. I hope you guys like color, because I like color, I like pictures. Tylenol is the biggest thing, the #1 call that we get. And sadly, it's also one of the most dangerous medicines in your cabinet at home. Acetaminophen is the generic name, and I showed you pictures of all the different things that it comes in, and you can maybe see my little pointer going. This is kind of the classic Tylenol, and if you were a little kid, wouldn't you want to taste that? I mean, it's so pretty. It's blue and red and white and pretty colors. And of course you would want to put that in your mouth. It looks like candy. These other forms of Tylenol, this one over here, the blue and white one, that is Tylenol PM. So it's got some Benadryl added to it for more layers of poison fun. Over here on this side, you'll see it called non-aspirin children's suspension liquid. So it doesn't always necessarily say right on the front what it is that you're giving your kiddo. You have to look on the back for the ingredients. Here's a little trick. Anytime you see APAP on a label, if it's on your prescription label or if it's on a label of a package, APAP is the pharmacy designation for acetaminophen, which is the generic name for Tylenol. And so you want to know that that means it has acetaminophen or Tylenol in the product. It is often paired with other medications, so it's often in your cold medicines. We got 1,525 calls on medicines containing Tylenol in 2020. And of those, we had to send 974 of them to the hospital. And believe it or not, one of my big jobs at the Poison Center is to watch kiddos at home as much as possible, to handle calls at home with a nurse watching out for them as much as possible. Between 65 and 80% of all our patients were able to monitor at home with us checking in on them. But Tylenol is really high risk. As you can see with Tylenol, we had 96 people with major effects. When I say major effect, I mean that person was admitted to an intensive care unit. And we had 6 people die of acetaminophen overdose in the year 2020. So this is last year's data. And what it does is it causes liver injury. So there are a lot of times, however, we are able to watch it at home. I just wanted to give you an idea of how a typical call goes. So mom calls me and she says, "Oh no, Tammy, I found my kiddo drinking from the Tylenol bottle. I have no idea how much she got." So here's a tip from the Poison Center nurse. Bring the bottle with you to the phone. So many times the upset parent, the first thing they do is throw the bottle away. And I have to say, well, okay, do you have the bottle? No, I threw it in the trash. Okay, go dig it out of the trash because I'm going to ask you some questions. So the question I want to know is, how old is the baby? How much does the baby weigh? Because I'm going to start calculating milligrams per kilogram to determine if there was a toxic dose ingested. So I'm going to say, look at this bottle of non-aspirin pain reliever and tell me, is the active ingredient acetaminophen? And mom's going to say yes. I'm going to say, it's usually a 4-ounce bottle. Is that right? The tip that I know is that it doesn't come in anything more than 4-ounce bottles. Thank you, Lord. That's why at Costco, they might sell it in a 3-pack of 4-ounce bottles, but they never sell it in more than a 4-ounce bottle because that helps me, the poison nurse. It helps us not to have too much of an overdose. So I'm going to say, Mama, is that bottle half full now? Is it still all the way full? How much do you think is missing? And I can start calculating how many ounces that kiddo might have gotten. I might say, is there a big old spill on the floor? Is it dumped all over her shirt? I can start calculating how much have we lost to this Tylenol? How much is maybe in that kiddo that I have to worry about? And I can start to get a really good idea of how much Tylenol is in that kiddo. I can start calculating milligrams per kilo possibly ingested. And is it safe to watch this baby at home, or do I have to send this baby to the hospital for a level? There is an antidote to this. It's very treatable when I know these things. So I may very well say to this parent, this is safe to watch at home. So if I tell you it's safe to watch at home, and I promise I wouldn't tell you it's safe to watch at home if it's not, then what I'm going to tell you to do is do not give your child any more medicine that has acetaminophen or APAP or Tylenol on the label. I'll tell you how many hours they can't have it. And then I'm going to tell you to watch for signs of a Tylenol overdose and call me back if you see these symptoms, which for Tylenol would be nausea, diarrhea, or vomiting. So that's kind of what your Poison Center nurse phone call would look like. And then I'm usually going to call you in an hour or two. I'm going to ask you to tell me your phone number. I'm going to ask you to tell me your kiddo's first name. That's so I can look them up later. And I'm going to call you in an hour or two to check on them and see if they're having any symptoms. That's kind of an idea of what your typical Poison Center phone call is going to look like. People always ask me this, so I'll tell you up front. There is no red light that goes off on my computer and says, boop, boop, boop. This mom has called me 3 times and she's on the list. It doesn't work like that. Sometimes I have moms that'll say, it's me again. You're not going to believe what the kid ate this week. And I'll kind of recognize the voice maybe because I have talked to them. Like I told you, there's only 13 of us nurses. And so if you have to call us fairly often, I might begin to recognize you. But if you don't tell me, I usually never know. If you were to call back and say, my kiddo is Layla, and I called you last week on Tuesday, and now she's throwing up, could it be related? I would literally have to go dig back through the database. I'd have to look back to last Tuesday. I'd have to put in the name Layla and the date last Tuesday and go find it. So just as an FYI, if anyone ever asks you, we aren't tracking you. It isn't that easy. You can call me 100 times. I'm not coming to get you. I don't have time. All right, so moving on to my next slide. The rest of them won't be this long, I promise. Anyone have any questions so far?
Tammy,
Yes.
there are a couple of questions on the chat, including one.
Sure, send them over. I can't see it. There it is. Okay. Can you give us an example of an adult call for acetaminophen? Absolutely. The stats on this slide also are not for just children. They're for all the calls for acetaminophen, by the way. So yes, what an adult call often sounds like is, oh no, Tammy, I just realized that I have taken my medicine too close together. And so I can calculate that out for adults too. That happens all the time. Or they realize that they have 2 medicines that contain acetaminophen. They might have taken a cold and flu medicine that has acetaminophen, and they also took their Tylenol arthritis strength. And they'll want me to figure out if it's a dangerous dose, and I can usually help them. I can go through and calculate for them. So that's what an adult call for Tylenol would look like. The danger calls for Tylenol, the ones that cause deaths most commonly, would be your person who has dental pain, who doesn't have a dentist, who has been taking Tylenol. They've heard in their heads, you know, for ibuprofen, there's a dose that you can take that's a prescription dose. And so they'll take 3 or 4 Tylenol instead of 1 or 2 Tylenol. And so you take 3 or 4 extra strength Tylenol every 2 or 3 hours for 2 or 3 days. And those people are the ones that are most likely to die. They come in nausea, vomiting, and they're in liver failure by the time they get to us. And those are the ones that are actually the hardest to treat and the highest risk for death. All right, I don't see any other things in the chat, so I'm going to go ahead and move forward. All right, so the next one that I see, come here, I got to click on my slide so it'll move, is aspirin. And I've showed you lots of pictures of aspirin. The classic one here in the top corner. Whoops, I accidentally moved my slide again. Classic one here in the top corner. And we have the little baby aspirins that a lot of us take to prevent heart attack. Aspirin is a pretty toxic drug in overdose, but we only had 350 calls in 2020. But it does have a high risk for injury, with 30 of those 221 that went to the hospital had major outcomes. What you might not know is that there's aspirin hiding in some things that you might not know it's there. And it does come in chewables. And we talked about little kids loving chewables, baby aspirin chewables. Those of you who happen to like your essential oils, wintergreen oil is highly toxic. It basically is a very concentrated form of aspirin. So if you like your oil of wintergreen, that one should be really put away and hidden. Good old Pepto-Bismol, the one that coats the only one you need, that is an aspirin. It is a bismuth subsalicylate. And then BC powders are aspirin. Luckily, they taste nasty, so we don't get a lot of kids ingesting much in the way of BC powder at a dangerous dose. In overdose, aspirin is highly, highly toxic. You start out vomiting and you end up having seizures. What to do at home. If I have a little kid that eats a couple of aspirin, a lot of times I can watch it at home. We tell you to give the little kiddo a snack. We're going to have you call us back if they have tummy upset, they start vomiting, or they're rubbing at their ears or saying their ears are ringing. Next one is ibuprofen. Nearest, we got a lot of calls for ibuprofen. It's in a lot of people's houses. But the good news about ibuprofen, it has a very wide margin of safety compared to Tylenol, compared to aspirin. The risk for injury is moderate. And in overdose, most of the time we're able to watch ibuprofen that kiddos get into at home. So if I hear a call and I hear ibuprofen, I tend to take a little bit more of a relaxed breath when I hear that one than when I hear some of the other calls coming in. So moving along, these are some of our topical medicines. And I just put lots of pictures up here. Believe it or not, one of the most common calls we get, I put the Boudreaux's butt paste just because I love that name and nobody can pronounce Boudreaux's when they call me. We get so many diaper cream calls. And if you think about it, it's on every changing table in America, and it's in probably every diaper bag in America. And babies grab it and they lick it. The good news is almost all of them have cod liver oil in it, so it doesn't taste good. Most babies just lick it. Every once in a while, there is that one outlier kid that likes it and sucks it down by the tubeful. That poor child is going to vomit it up in strings and get some pretty good diarrhea. But what I would like you to look at on this PowerPoint is, look at your cortisone 10. What does that tube look like if you just glance at it? Does it look like a popular toothpaste brand?
Yeah.
This is actually one of our most common calls, is people accidentally brushing their teeth with cortisone 10. It is, the good news is it doesn't hurt you to accidentally brush your teeth with it, but that is such a common call. I probably get one of those 2 or 3 times a week. Someone brushes their teeth with it. Some of the most dangerous things I want to point out to you on this slide of our topicals is Benadryl. We actually there's been a few cases of some shady daycare workers who were putting Benadryl cream on babies to make them sleep. Benadryl cream can be highly toxic, both applied to skin in excessive amounts and eaten. So it can be very dangerous. Your Vicks Vapor Rub has camphor in it, and more than a mouthful or 2 of that can cause a seizure. So there's some dangerous things on this slide. And then your good old Ambisol toothache medicine, when eaten in large quantities, can cause some problems, a rare condition called methemoglobinemia. So don't let your kid chew the Ambisol. And then some of these muscle rubs, some of them are just peppermint oil, and some of them have aspirin in them in the form of something called methyl salicylate. So you can see that we got a lot of calls on these. Most of them we were able to watch at home, but don't let your guard down just because it's in a cream form. All right, so moving down the list of things that we get calls on are your antihistamines. Benadryl or diphenhydramine. You'll often see it called sometimes Aladryl, children's allergy relief. And I guess I want to pause real quick and see if anybody has any questions so far. We doing okay? Those of you I can see are thumbs upping me.
Looking good.
Okay. So Benadryl, we got a pretty high number of calls for, and you'll see 620 calls, and of those 509 we had to send to the emergency room. That's a pretty high amount that we were not able to watch at home, because this drug has some pretty significant effects in overdose. The risk for injury is pretty high. 57 people ended up in the ICU. 1 person died of a Benadryl overdose. And it might not have been in 2020, but we have fairly recently had a child who died of a Benadryl, or diphenhydramine is the generic name, overdose. If I ask you to watch at home, and there is a dose that is safe to watch at home, I tell people that you're going to get one of the 7 dwarfs. You're either going to get sleepy or grumpy, because kids can react to it in one of those 2 ways. If they are sleepy, I'll tell you that they can have a supervised nap. And what I mean by a supervised nap is they can take a nap, but I just want you to be keeping an eye on them, checking in on them, making sure that they're doing okay. It does come in a chewable. The good news about the way they make their chewables is usually these chewables are in these really hard to get through, kind of push through packs. And I have not seen kids have an easy time overdosing on chewable diphenhydramine, luckily. So the overdoses with kids that we see that generally are problematic are where they drink the liquid. Even in the small 4-ounce bottles, there's enough of the liquid for them to drink that it can get them into trouble with this drug. And I'm going to talk a little bit more about suicide attempts later, but this drug can be quite toxic for adolescents who are attempting suicide. So we'll get to that later on in this presentation. Now here are all of our other allergy medicines. I listed them together because we call them the non-drowsy or non-sedating antihistamines. And those are your cetirizine, also called Zyrtec, your loratadine, also called Claritin, and your fexofenadine, also called Allegra. These are very low risk. We almost never send anybody to the ER for these. In fact, the 80 that were seen in the ER were almost always parents who took them to the ER and did not call a poison center, or were maybe kiddos who attempted suicide. Any suicide attempt we send to the emergency room, because suicide is always considered a life-threatening emergency, even if the drug itself wasn't that dangerous. But yeah, anytime I hear this drug, I relax a little. And you just don't get many effects from this one. Maybe some minor drowsiness, maybe a slightly dry mouth. It usually doesn't even make kiddos sleepy. So as a poison center nurse, I would always kind of prefer to have this allergy medicine in my cabinet as opposed to Benadryl, for example, if I'm making a choice. Now we're on to kind of a big one. Anybody have any questions so far? Are we good? Okay. So this is a big one, guys. This is dextromethorphan. You might see it called Delsym or Robitussin. You might have heard it called Triple C or Coricidin HVP. It's your #1 cough medicine that's in the over-the-counter market today. Justin Bieber's favorite drug of abuse. I think he's been to rehab. I don't think he's still abusing, last I heard. We got 289 calls for this one in 2020. 110 of them went to the emergency room. This drug, they've talked about taking it off the over-the-counter market, but there's not really anything to replace it with. So it doesn't look like it's going to happen anytime soon. It's not a great drug for little kids. It causes sedation and it causes agitated or psychotic behavior in overdose. That's why the teenagers take it. You can look it up on YouTube or on any of your Google searches under robotripping. You'll hear it called Sizzurp, purple nurple. They have all kinds of things that they call it. If you have teenagers, signs of abuse of this drug, if you're looking for those, if you see boxes of cough and cold medicine or these packets over here with lots of blister packs that are empty in trash cans, you really need to start being concerned about this. It is addictive. There are many young adults who are quite addicted to this medication. We see frequently coming through emergency rooms. It causes agitation and psychosis in overdose. It's similar to ketamine in its properties. I don't know if you've heard of ketamine abuse, but kind of similar to that drug, and quite toxic in overdose. So we do watch kids at home who get into this. Sometimes adults accidentally take too much of it. The Delsym is the 12-hour formula of it that is longer lasting. It's the only extended release form. And I don't know if a lot of you know this, but Robitussin or dextromethorphan is not recommended for children under the age of 5 or 6. The American Academy of Pediatrics has come out and found that there is no benefit to giving it to them. It does not help their cough. And so actually they've done some really good studies. If a child is older than 12 months old, so if you're a baby, you can't have honey because of the risk of botulism. But if a child is under 5 years old and older than 12 months, and actually even for adults, they found that a teaspoonful of honey actually soothes a nagging cough just as well as dextromethorphan in double-blinded studies. So go out there and support your local bees and get rid of this dangerous medicine in your cabinets. The other thing is this medicine is often mixed with other drugs. So in the Coricidin cough and cold, for example, it's mixed with an antihistamine that's very similar to NyQuil, to diphenhydramine. And so you get a mixed toxicity that makes people really sick. In your NyQuil, it's mixed with another kind of antihistamine called doxylamine and with acetaminophen. So when people drink the whole bottle of that, they're getting risk for liver failure and risk for the antihistamine overdose symptoms, as well as getting high on the dextromethorphan. So it can be quite a significant problem. So not my favorite drug. Any questions on that one? Okay. This is a fun slide. I want you to look at this one and look at all these fun little chewables, chewable things for stomach relief. Yes. Somebody have a question for me? I lost you.
I think she was just logging in, so I'm gonna go ahead and mute.
All right, that's okay. All right, so this slide is fun. I just put up lots of pictures here of all the different chewable stomach things. And I wondered if anybody wanted to vote for me on what you think is the most dangerous medication for a kiddo to chew up on this PowerPoint. There are two that make your poison center nurse very concerned as soon as I hear them. Oh, I got one in the chat. Somebody's voting. All right, Pepto Kids. All right, anybody else want to vote? Oh, somebody's got an inside track here. All right. So I'm giving bonus points to Fiorella and Joanna. So when I see the simethicone gas relief, that's my favorite call to get on the slide because simethicone passes through completely unchanged. And so it doesn't go into the bloodstream at all. So you can eat all the gas relief tablets you want. And I'm not worried. The Pepto Kids and the Tums, it's almost impossible to kill yourself with a calcium carbonate overdose. You can make yourself constipated. So not worried about that one. But Joanna and Fiorella, the ondansetron or Zofran, a lot of pregnant women have that. A lot of people on chemotherapy have this, and it is a chewable tablet. It can put a child into a coma. And I have had a kiddo who got very, very sick on this. Mama was pregnant and had prenatal nausea and vomiting. And her little guy got into these 8 milligram tablets and managed to punch them out. And they're not easy to get out, managed to punch them out of the little packets. And when Mama called me, that child was talking and I could hear this kiddo talking. And I said, go straight to the ER. And literally by the time they got to the ER, that child was very, very lethargic and difficult to arouse and ended up needing to be intubated with this Zofran or ondansetron nausea medicine. And then the Imodium, Joanna and Fiorella are right. Imodium, very, very toxic. In overdose, it acts like a narcotic, an opioid, and causes central nervous system depression. And then the other one that makes me worried in overdose is good old Pepto-Bismol for grownups, has aspirin qualities. Usually they don't chew enough of that one to make them sick, but it still worries me. Rolaids has some magnesium in it, so you can get sick from Rolaids. Usually what's in a roll is not enough, so we're okay with that one. All right, so I think we're still okay on time. I am moving on to the gummies. Oh my goodness, guys, the gummy calls. I get gummy calls every day, all day. Kids love gummies. Gummies are crack to small people. Oops, I see something in the chat. Stops things from moving. Honestly, though, the people who are addicted to Imodium tell me that they take boxes and boxes all day long and it doesn't do a thing for them. So, but these gummy vitamins, guys, the good news about gummy vitamins is as long as they don't have iron in them, and most of them don't, they don't tend to make kids very sick, even though they will eat the entire jar. The bad news is kids are getting them every day. They're eating whole bottles of them. The next call is melatonin. Melatonin comes in a gummy. Did you guys know that? It comes in chewables, it comes in gummies, it comes in all kinds of lovely, yummy flavors. And I get melatonin calls 2, 3, 4 times a day. The good news is it wears off quickly. The risk in kids is low. I have had kids eat as many as 98 10-milligram gummies and only get mildly sleepy and stare at the TV for an hour or so and then get up and start running around again. So thankfully, not very toxic, but still you should know that it is not a risk-free thing and kids are eating it. Last but not least, Fiorella promised I was going to talk to you about THC. I am not judging. If you like your THC, go for it. It is coming to Virginia, y'all. We are, I don't know if you've seen that cute meme with the fried marijuana leaves. It says, you know, as soon as THC is legal in the South. But as of July, it's coming. Our poison specialist friends in Colorado have been helping us get ready. THC is not a friend to kids. And also, let me warn you, your dogs. Dogs do not tolerate marijuana well at all. It kills them. And kids do not tolerate it well at all. It puts them into comas with as little as 0.2 to 0.4 milligrams per kilo. And a kilo is 2.2, there's 2.2 pounds in a kilo. So your average toddler weighs about 30 pounds, 20, 30 pounds. So think about this, your average marijuana edible, and I had to look this up, I am not a marijuana expert by any means, has 10 to 15 milligrams of THC. And some of them come with up to 100 milligrams. Luckily, most of them now come labeled, I'm told. So the other bad news is it can take up to 2 hours for the symptoms to start. So parents don't know always that their kiddo got into it right away. But you think about it, a little kid that sees a cookie or a lollipop or these marijuana gummies or these marijuana candy bars, or a parent that sees that the kid got into it, but they look fine at first, they don't realize the danger that's happening. A kiddo is never going to eat just a bite of your marijuana brownie. They're going to eat the whole thing when they get it. And one marijuana gummy is a toxic dose for most kids. It takes up to 2 hours for the symptoms to start. So your kid looks fine. If they ate that gummy at 6 o'clock and you put them to bed at 8, they literally can wake up dead because you didn't know what to watch for. And we are already seeing this. And I went ahead, I want to talk to you about these Delta 8 THC gummies, because we are already seeing kids. I just worked at the Poison Center the last 2 days, and I've had a kiddo in the ICU almost every shift I've worked the last couple of weeks from these Delta 8 THC gummy bears. They come about 20 to 30 milligrams. The Delta 8 THC is supposed to be less psychoactive than regular THC. It's a synthetic. It comes from CBD and hemp, so it's not from real marijuana, so people think it's not as dangerous. You can buy it on Amazon and on the internet. You can already get it in Virginia, so lots and lots of people have it. And in fact, this one little guy that we had that got into it, the grandparents had him and they're like, oh no, our daughter doesn't, his mama doesn't ever use marijuana. She's not a user. And we said, well, what about, hemp or CBD? And they said, not that we know of. But turned out mama had bought, mama was having knee pain and bought some of these Delta 8 THC gummies, which is not an unreasonable thing to do. It's becoming very popular. There are usually these packets come with 500 milligrams worth of the gummies, 20 to 30 milligrams a gummy. So your average 20 kilo toddler, one gummy is more than toxic, because the toxic dose is 0.6 milligrams per kilo. So this kiddo had eaten 500 milligrams worth of gummies. That kidlet was in the ICU for 2 days, had to be intubated. They come in so lethargic and comatose that we can't respond, that we can't get them to arouse even with sternal rubs. They don't react. They are not breathing enough. We have to intubate them and breathe for them with a ventilator. Their blood pressure is so low. Often we have to give IV fluids. Sometimes we have to give vasopressors to raise their blood pressure. These are sick kiddos. And it usually lasts, the average ICU stay for these kiddos has been at least 1 or 2 nights before we're able to get them back home. So do not ignore this. Pay attention in your people that you're educating. Especially point out that these Delta 8 THC gummies, I'm going to say, I would not recommend, if you have kids or grandkids, I would not recommend that if you're using CBD, if you want to try it for your pain, would not recommend that you have it in the house. I see somebody in the chat. Let me see if I can answer a question. Let's see. Somebody said 6-year-old ate candy flavored, only ate one, was hospitalized, turned her urine brown, does something to kidneys. That would probably be from the low blood pressure, not being able to perfuse your kidneys. Clinical effects from marijuana, kids versus adults. Kids, it's just so much, they can't handle the dose. They end up in a coma. An adult ends up a little high or stoned. Kiddo ends up in the ICU in a coma, intubated, is the biggest difference in the clinical effects from marijuana, kids versus adults. So it's all dose dependent. Their little bodies can't process it as well as we can. So that would be the biggest things I would want to share with you on that. And I'm looking at my time. Let me keep moving. If you come up with more questions at the end, I'll get to it. Okay. All right. So let's see. Last but not least, I wanted to quickly go over suicide, because sadly, even before COVID, suicide rates had increased in the teen and adolescent population. When I say this, I mean age 10 to 19 by 141% from 2010 to 2018. And this is before 2020 happened, you guys. In 2020, Fiorella and I just have some rough numbers, but our calls in 2019 or 2018 that were suicide calls to the Poison Center were around 3,000. And in 2020, our suicide overdose attempt calls were over 5,000. So we estimate that as a rough estimate of 63% just in the 1 year. And we already had an increase. And I see some chat questions here. What about teens? Where's the cutoff? It's 10 to 19 is what we're calling. Teens is the same. It's all by body weight and size for your marijuana effects. So suicide is the second leading cause of death in teens now. The leading cause of death is accidental trauma. So second leading cause of death now in teens and adolescents, so age 10 to actually 24 in the United States, is suicide. They take what's available to them. It's acetaminophen. The second thing is their own antidepressants. And the third leading cause of death is Benadryl. And most of our hospital referrals are for, many of our hospital referrals are for suicide attempts. So in a lot of those numbers that I showed you back there, it was suicidal attempts that we were sending them to the hospital for, because we always consider attempting suicide to be a life-threatening emergency. So I wanted to give you this information. It will be in the recorded webinar. Fiorella has all of these numbers. The crisis text line for your teenagers is great. Crisis doesn't just mean suicide. It's any painful emotion for your kids. The National Suicide Prevention Lifeline, fantastic place number to give out. This wonderful website for resources called onoursleeves.org. Some other places you can refer people to would be school counselors, your local church. A lot of local churches have counseling available. Just some of the ideas that I have and have been able to get help for. And then medication safety tips from your poison specialist. Never, ever call medicine candy. Start teaching early about medicine, even little toddlers. Use age-appropriate language. I'm a pediatric nurse, so use developmentally appropriate language when you talk to your kiddos about medicine. From a very early age, I have 3 kids of my own, and now I have 2 grandbabies. And we talk about, you know, this is a medicine that we're taking to help us get well when we're sick. Practice and ask questions with them. So when it's time to give a medicine, I say, you know, what is this? You know, this is a pretty color. Is it a medicine or is this a candy? What do you think? And I get them to, you know, talk back about it with me. We're going to drink this now. Is this medicine or is this candy? Is this your medicine or is this Mimi's medicine? You can start teaching those things very young to little people. And actually in our house, we have a medicine trade-in program with my grandbabies that we initiated because granddad drops his pills. And so we started this and it actually has worked very well. If you aren't sure what you found, if you pick it up and bring it to a grown-up, we will trade it for candy. And that has been one of the things that we find has worked very well. We love it. My grandbaby Jackson has traded many, many things for candy that don't even begin to look like a pill, including floor lint. Is this a pill? It is not. It is a fuzz, but I will still give you a Smartie. And but he also did find a dropped vitamin D tablet. And happily came and traded it. He did not eat it. He brought it to me, traded it for a candy. Remember, nothing is child-proof. I mean, if you go and read, it's really interesting to read how they call something child-resistant. They take pairs of children and put them in the room with it, and the kids get 5 minutes with it. And it only, it's a 50-child set, and it can still pass if there are 2 children out of the 50 that can get into it within the 5 minutes. Can still be called child resistant and pass the testing. Also, the adults have to be able to open it. So nothing is child proof. You only have a head start against the kid getting into it. You don't know if your kid is one of the 2 out of the 50 that's good with their hands that made it through that particular testing phase. Let's see what we have in the chat. Oh, somebody likes my idea. Yeah, my medicine trade-in program has so far worked well in our family. So the next set of tips I have a designated place where your medicines are kept. It should be high and hard to reach. That doesn't mean they won't climb to get it though. They still will climb. So it should also have a child safety lock. And then let's face it, I've talked to you about suicidal teens. You can also have a closet with an outdoor doorknob that you unlock with a key or a combination code. And I've got some pictures for you. There are some times when you have teens or adolescents who are so high risk with medications. Sometimes there are kids that are so high risk with medications. I had a friend at one of my pickleball classes yesterday. I was talking about this webinar. And she said, oh yeah, I had a sister who had her stomach pumped 3 times. There's the kid that you might need to have a closet and convert it to special. And if you do that, you also need to make sure that they can't pop the hinges, but you might need to convert it to an outdoor door lock with a combo code or a key that only you know. If you can, keep your pills in their original bottles and write the start date on the label. Please, please don't take your old pills from your old bottle, dump them into the new bottle. Then if I ask you, you know, how many pills were in that bottle to start with, you have no idea. So many times we get that. I'll say, well, let's, you know, my kiddo got into my medicine bottle. Well, when was it filled? Well, it was filled yesterday, but I took the pills from the last time and I dumped them in there, and I don't really take them that regularly. So honestly, I have no idea how many might be left, or we can't get an accurate count. So if you keep them in their original bottles and you write the start date on the label, then you have a really good idea, at least how many pills I'm dealing with that the kiddo might have gotten. If you use a pill minder, keep it locked away, and remember, they make them child resistant. So child resistant pill minders are great. And remind your grandparents and other relatives to put them away and give them a child resistant pill minder if they visit often or if they babysit for you. Next slide. I have some great pictures. Look, here's these wonderful locking pill boxes. They have combo codes. This is one of the outdoor door locks I was telling you about. You can get them for low as about $126. Cabinet locks. This is a great thing. This is a purse pill lock that you can put in your purse or your diaper bag. And this is a locking pill minder. Remember, child resistant, not child proof, but still a great idea. Here's some other tips. Kiddos love to hunt. Check your purse, check your diaper bag, coat pockets, nightstands, pickleball bag if you happen to be addicts like me, the top of your dresser, your bathroom counters. They will go all of those places. They are sneaky. And then this is my last one. It says, your child finding your chocolate stash. Then here's my last slide. This is the Virginia Poison Center website with lots of other tips and ideas for you. It is poison.vcu.edu. Our wonderful Fiorella keeps it always up to date. You can click on public education. We have tons of up-to-date new sheets and ideas. There's resources. There's our phone number if you want to call us. I think Fiorella has pictures of all of us on it now. And if you have any questions, I am ready. Hit me. Let's see, where's my question slide? There we go, questions.
I don't see any on the chat, but yeah, I guess some of the things that we're, I guess, getting ready in the Poison Center is we know the law is changing when it comes to marijuana, so this is something that we'll be doing more webinars on, and starting from Marijuana 101 and experiences that I've used to work in Oregon as the educator there. So experiences from being the public educator and going through all those changes and what we've seen in public health. So, you know, be on the lookout for those kind of things. Let's see if I have any questions. Okay, so I have one. So how far in advance did you start preparing for legalization? Well, from Tammy's perspective, she says since it started in Colorado, so that's a while.
We really have been training and planning for it a long time, getting ready. And we've actually been, we've always gotten marijuana calls, but we're really ramping up now. Working on specific guidelines, talking to other poison centers.
And yeah, so I would say here, from the public ed perspective, it took a little bit later. So I would say all the information that I gather when I was working in Oregon and then moving here, and all the studies that we've seen, we're definitely working on compiling them and sending out sheets and handouts for people. Especially this whole new Delta 8 kind of just took us by surprise. So there's always going to be more things like that. So just, again, be on the lookout. And if you can follow us, it's Virginia Poison Center, either on Facebook and Twitter. They're both of them. You can find us there.
Oh, and if you can really encourage people, we are not calling CPS on you. So especially for the THC and marijuana, we don't want people to be afraid to call us. And we don't want people to be afraid to take their kids to the hospital. I've been really getting, when I recommend that they take these kiddos to the hospital, I've been really getting parents afraid to go. And that's a real barrier. Sometimes hospitals do call CPS, especially when you have a comatose kiddo, but that's going to happen pretty much anytime you have a comatose intubated kiddo. But if your kid dies because you didn't take them to the hospital, that's much more likely going to get you in trouble than if you took them because of an accident. So that's what I try to tell them. Does that help? And they are at high risk for death.
And yes, and if you're interested in what kind of messaging to start working on when it comes to marijuana education, just be prepared, because there will always be people that are not going to agree with you. One time I was at a table, it said poison control table, and I was at an event that we're talking about marijuana and if it has any benefits, especially for kids with seizures. And now we know that, there's a CBD for that has been approved. And I was asked, well, why are you here? Marijuana is not a poison. And here I am with a big table that says poison control. So you will see all sorts of reactions. One thing everyone seemed to agree, at least when I was working in the West Coast, it was they don't want youth to get into marijuana. So everyone agreed. And then you always have, but they say no one has died from it. Well, yeah, something that you get.
I often say, Fiorella, everything is a poison. It's the dose that matters. Caffeine, is a poison, but we drink it every day in our coffee and we love it in our chocolate. So it's all about the dose and the careful use of anything. And yes, kids have died from marijuana toxicity. And lots of pets have died from marijuana toxicity. Lots of dogs have died from it in Colorado. That was one of the first things they started seeing, was a lot of pet deaths. And yes, kids too. Don't let your dog eat your cookies.
Yeah, it's pretty scary. Different veterinary hospitals, they will start seeing more and more, people coming in with their dogs, and the dogs are walking a little bit funny, and it is very scary. But it adds another thing, for them to decide, okay, is this dog suffering from, some kind of nervous system problem, or is it marijuana?
And yes, the Delta 8
Mm.
also. It's
Yeah.
less toxic, but still toxic.
Yes. Joanna said, I wonder what changes came to the forefront in the states where it's already legal. I'm not sure if it's legal changes or perhaps you're seeing, maybe you're talking about things like more accidents or things like that. They are a lot of reports that they are seeing. So they have increased, but not necessarily just marijuana itself. It was always, most always with alcohol. So it was kind of like, okay, have they really increased? So it's just alcohol, but have they started using both when people were stopped by, traffic police? That's something that was seen, but we are working on a PowerPoint and trying to get people from, yes, so trying to get people from the other side, meaning the West Coast, and get all the information, trying to gather and, set up another webinar on all that stuff. I have seen, so for example, firefighters, I would talk to them, and this probably, they weren't sure if this is, something that it involves them or not, but people were really scared. They didn't know who to call, and they didn't even call the Poison Center, but they were wondering if their neighbor next door was smoking marijuana. And they were wondering, is it gonna get to me? Am I gonna, get sick from it, or is my kid gonna? So there's just so much to it. I mean, potentially some things can happen, especially when they're developing their butane hash oils. So there's something that they have started seeing, and some fires that started from trying to get their dabs and their oils. But again, right now is more of things that I've seen, but we are working on getting it all neat in a nice webinar presentation with reports and other people, hopefully from Washington and Oregon. So stay tuned. And poisonings, at least in the Oregon Poison Center, what they saw was an increase when things started changing, when recreational marijuana started, but then it kind of just leveled down, and it just kind of, there was definitely an increase, but then it kind of just leveled to what we had before. So that has just been very interesting to see. So again, lots of a lot of experiences from the other side that the country, that they're seeing lots of this information. If smoking tobacco has been curbed so much, why the decision to allow others to be exposed to cannabis?
A good question.
Yeah, that is a very good question. So I don't know. I mean, yeah, that this is something that they would say, something is combustion is combustion, regardless of what the actual substance is cannabis or nicotine and other things, but tobacco, right?
This is Virginia, right?
Something Virginia, so it's something that we've seen. So we don't know what we're gonna see. Like what they've seen is like a lot of kids getting into mainly edibles and concentrates. Even adults, those where the problems kind of start, is where they're seeing a lot more. Haven't seen lots of the actual smoke, but yeah, you're right. That makes no sense.
The Poison Center only has a staff of 20. I guess our votes didn't count very much.
Yes, I don't know. Anyway, but we can be here for a very long time. But for purposes of ending the presentation and gathering things up for at the end of the day, we will send an email out with this recording. And stay tuned. We will have more to say, and especially on marijuana, because this is a hot topic, right, Tammy?
I guess so, yeah.
Okay. All right. Thank you. Well, thank you so much. Thank you. Thanks, Tammy. Bye, everyone.
Bye-bye.